Hi guys, welcome back to another video. I am Oye. If this is your first time stopping by, please do want to subscribe if you are not yet subscribed, and make sure to give the video a thumbs up if you like it. Today I'm going to be making a video about what you need to know while studying medicine in Nigeria or before studying medicine in Nigeria. I created some questions that I am going to be answering. These questions basically entail everything that I feel you would need to know about studying medicine in Nigeria. So I'm just going to be answering them one by one. Duration of study for medicine in Nigeria is 6 years. But mind you, many factors could actually make this be more than 6 years. It could be 6 years, 7 years, 8 years, 9 years, 10 years, till infinity. Who knows? So the factors that could actually cause this are strike, a pandemic, COVID, anything can actually cause this. So when you are entering medical school, have it at the back of your mind that you might spend more. But this also depends on the school that you are in. If you are in a private school, there are very slim chances of you spending more than the 6 years that you are normally supposed to spend. The degree for medicine is MBBS, which is Bachelor of Medicine, Bachelor of Surgery. So this is the degree that you will get when you are done with medical school. You can either choose to go to a private school or a public school. A public school could either be a federal school or a state school. Generally, they have the same curriculum, they do the same things, but the only thing is that you might be more comfortable in a private school because, of course, you pay more, and I feel like you'll be in a more conducive environment, like your lecture halls, the hostel, and many other things. That's what I think. But there are also many federal and state schools that are actually still very good. So you can just make your research on the different schools that do medicine and are also very nice. Financial implication for studying medicine is basically more than what you spend for any other course in the university. The fees could range from hundreds to millions depending on the school that you are in. If you are in a private school, you most likely spend millions. If you are in a public school, you most likely spend thousands. But also, most state schools are actually more expensive than federal schools. Federal schools usually have the cheapest fees. The admission process, I'm not really going to dive so much into this because I feel this could actually be like a whole other video, but I'm just going to tell you the basics or the points you need to note. To get admission into medicine, the same way you get admission into other courses where you have to do JAMB, WAEC or NECO, and also the post-UTME. The subjects you'll be writing in JAMB are English, physics, chemistry, and biology, and the subjects you need credits in either WAEC or NECO are math, English, physics, chemistry, and biology. So you need 5 credits in your WAEC or NECO, and you need to write 4 courses in JAMB. And you also write post-UTME, which is post-JAMB, and that will entail almost the same courses you did in JAMB and WAEC or NECO. I think it will also entail aptitude tests or so. I'm not really sure, but it might also differ from school to school. So you have to beat the cutoff mark that your school brings out for that particular year. Mind you, this would actually depend on how much people pass that year or how much people fail that year. So medical school in Nigeria is usually divided into 2 phases, I would say. So we have the preclinicals and the clinicals. Preclinicals is from 100 level to 300 level, and clinicals is from 400 level to 600 level. In preclinicals, there is no patient interaction. In clinicals, you tend to interact with patients and you are seeing live patients. The courses that you'll be offering in medical school are also divided into 2, which are the preclinical courses and the clinical courses. So in level 1, you'll basically be doing things that you did in secondary school. I like to just call it secondary school pro max. Like you are basically doing physics, chemistry, biology, math. The only thing is they just have fancy numbers in their front, like 101, 100 this, 100 that. Might just be a little or a tiny bit advanced, but it's really nothing serious. Very much doable. You are supposed to pass everything. I don't know if it applies in all schools, but in my school you are not allowed to fail any course in 100 level. You are meant to pass every single one of them, and I feel it's very much doable because most people actually pass. So in 200 and 300 level, the courses that would be offered are anatomy, physiology, medical biochemistry, and integrated paper. So anatomy is just basically the human body, the structure of the human body, the different parts, how they work, and the rest. While physiology basically tells you how the body system works, it's basically function. Anatomy is structure. Anatomy will basically just tell you this is the heart, this is the structure of the heart, while physiology will tell you how the heart itself works, the function of the heart, how it contracts, and the rest. So I think that's like a good example to differentiate anatomy and physiology. So medical biochemistry is just about the background chemistry, the pathways, mechanisms of different stuff, I would say, that just happen in the body. So everything at the end of the day just work hand in hand. So at that time you are learning anatomy, physiology, and biochemistry together. So everything is just, coming through, and you just follow it like that. And the last, which is integrated paper, I believe not all schools actually do this. It actually entails community medicine, basic pathology, pharmacology, just the basics, but many schools just do community medicine. At the time in my school, we just taught the basic pharmacology and pathology together with community medicine, of course. So for clinicals in 400 level, the main thing in 400 level is pathology and pharmacology, but 400 level is also the level where you'll be introduced into clinicals. You are going to be introduced to medicine, surgery, obstetrics and gynecology, and pediatrics. So it's just mainly introduction to clinicals, and then you'd be doing pathology and pharmacology, which is the main thing to be done in 400 level. So pathology just mainly introduces you to all diseases that could be found in the human body, in the human system, while pharmacology tells you about the drugs that could treat different illnesses. So you learn how drugs work in the body. While 500 level, the main posting is obstetrics and gynecology and pediatrics. Obstetrics and gynecology is mainly about women, pregnant women and non-pregnant women. Obstetrics is about pregnant women, while gynecology is about non-pregnant women. Pediatrics has to do with children. In 500 level, there are also other things you'll be doing. You'll still do medicine and surgery, and you also do family medicine. Family medicine is just like the first contact a patient will get when the patient comes to a teaching hospital. The first doctor the patient is going to see is a family physician, which will then refer the patients to other specialties that they feel the patient will benefit from. It's actually broad because it entails a lot of things. Just imagine a specialty that entails every single thing about medicine. I'm just simplifying things. They are actually more complex, but I'm trying to just make them as simple as possible. In 500 level, you also do subspecialties, which entails ophthalmology, the eye, radiology, x-rays, radiological investigations, and the rest. We also do anesthesiology, which is like the specialty that involves putting a patient to sleep, that handles pain. In 600 level, you'll be doing community medicine, psychiatry, and medicine and surgery. So those are like the main things that will be done in 600 level. So the exams are usually CAs and MB. CA is continuous assessment and MB is medical boards. So MB is like the main exam, while CA is just like tests. But usually they are both structured the same way, like they have the same things. There's nothing really different. It's just that the marks assigned to CAs are less than those assigned to MB. So in preclinicals, the exam entails MCQs, theories, practicals. So MCQs is multiple choice questions. There could be multiple correct answers in a question, so you just have to write true, false, true, false, true, false. If option A is true, you write true. If it's false, you write false. Like you are answering each option, not just picking one correct answer in the question. The MCQs usually come with negative marking. You are not supposed to guess an answer, so if you don't know it, I advise you just leave it. If you write the wrong answer, they could subtract marks from your total score. So they could either subtract 1 mark, they could subtract 0.5, 0.2, or sometimes they won't even subtract at all. But normally that's the way the exam is standard. In clinicals, the exams are usually MCQs, theories, and OSCE. MCQs the same way it was in preclinicals, theories the same way. They give you different questions to answer. Then OSCE is like the only different thing. OSCE means objective structured clinical examination. It's just mainly testing your clinical skills, like things you learn in the hospital. That is what OSCE tests. So there are different stations. It actually entails like a lot of stuff which I would not just go into. You could be giving patients to clerk, to examine, ask different questions that are related to clinical stuff. Yeah, basically. So I think I've been able to give a full rundown of most things that you would need to know about studying medicine in Nigeria. It actually entails a lot, and it is really not the easiest things to do, but it is very much doable, like very much doable. So the main thing that should just be done at the end of the day is focusing and just having this discipline to do things at the right time, and I feel it should just be quite easy. It's not going to be the easiest, but it's very much doable. This is me encouraging aspiring medics to know that they can actually do this. So if you have any questions, please leave it in the comment section. And with this, we have finally come to the end of this video, and I hope you enjoyed watching. Please don't forget to subscribe if you're not yet subscribed, and also turn on your post notifications so you get notified anytime I post a video. And also please give the video a thumbs up if you like it. Thank you for watching. I'll see you in my next video. Bye.